I had a heart attack in June of 2018. I was still having a lot of difficulty breathing, running out of breath. I couldn't even walk 25 yards from my front porch to my mailbox without totally being out of breath.
Mr. Rorie, a pleasant gentleman who's been dealing with heart failure for a few years now. So he's been real compliant with medications, taking them regularly and regular doctor visits, but was still having trouble with just not as much energy and shortness of breath and not feeling as good as he could. So we talked to him about this new device. It's new technology that paces the heart in a certain way to where it times electrical impulses to where the heart can gradually get stronger and can help a person walk farther, have less shortness of breath, and feel better from their heart failure symptoms.
When they got through explaining everything to me, I couldn't wait to get it done.
We implanted the first cardiac contractility modulation device. We're the first one in the Charlotte region to implant this device. And it has a couple of leads that are attached to it that go down into the heart, follow the vein down to the heart. So the only incision we make is just right up here below the collarbone. It takes approximately 2 hours to implant the device. Then we stitch that area closed, and we're actually able to get most people home later that same day.
I've been so amazed with this device and the procedure. When they told me that I'd probably go home that afternoon, I said, "You have got to be kidding me." But actually, that's what happened. You know, they kept me in recovery for a few hours, and then once they said everything looked good, they said, "You can go home."
We're dealing with individuals whose heart pumping function has been weakened for quite a while, so it gradually gets stronger. It takes a few weeks or even a few 2-3 months before we see the full effect. So we expect that Mr. Rorie will gradually start to feel better over several weeks' time, get stronger, less shortness of breath, be able to walk farther and do more of the activities that he'd like to do.
I can tell that the device is working, and I'm just very anxious to see when it gets to its max. I'm looking forward to that.
So it does open up a new opportunity for people who might be in the situation where they're thinking about, do I need a heart transplant or do I need an artificial heart pump? This is a less invasive way to potentially help some of those individuals feel better through a device that's just this size and goes under the skin. It's a procedure, it's an outpatient procedure, you get to go home later that same day. So we're really excited to have this opportunity to offer something new that can help people feel better.